If not, if we could have a motion to approve.
I've reviewed and I move to approve.
Any seconds?
Second.
Excellent. And then we also had revised Board of Health minutes from February 18th. Any revisions or comments there?
Those were my revisions, modest revisions, and the revised version is accurate, and so I think that they should be approved based on that being the only correction that was required.
Great, and I'll second that. All right, so organizational issues. So I just wanted to mention a few things about the month of April. April is Counseling Awareness Month. It also is Autism Awareness Month, and on April 2nd, that was World Autism Awareness Day. It is also Sexual Assault Awareness and Prevention Month. And just to bring up a few things, April 22nd is Earth Day, and on April 25th, this Friday, at 10 a.m. at the Willows, the Township is sponsoring an Arbor Day celebration. So I wanted to bring that up because it deals with our parks, which obviously are involved with our health. Any other comments about upcoming events from the board? Okay. So we're going to have a student internship update. We'll have Chloe and Bobby do that for us.
Okay, so Alice was not able to be here tonight. She continues to add to her project, which deals with how physical exercise and specific breathing techniques help to reduce stress in teens. She's got some really good, solid research that she's been working with. And I know she's working also, she continues to work with Mrs. Roseland, the health teacher at the school. She is setting up an appointment still. She hasn't yet to be able to meet with other therapists at the college that I am at, but she's still working on that. And she has just completed a assessment. She did a sampling of 35 students, gave them a little breathing technique to do, asked before and after questions, just to get a sampling. And so she's completed that.
Excellent. Chloe?
So I'm focusing on examining the correlation between the nutritional value of school lunches and the academic well-being and performance of students at Radnor High School. And as a part of my research, I looked into guidelines surrounding school vending machines and what's in the Radnor High School vending machines currently. And I met with the guidance counselor to get approval for my survey. I finished that, looked into the correlation between nutritional value and academic well-being. And I also interviewed the Radnor High School food service coordinator at the high school, and I gathered insight that could help us understand the impact of school lunches on academic performance.
Excellent. Am I to understand that you guys will be ready to present, or Alice will be ready, Chloe will be ready to present next month? Yes. Okay, excellent. So that's our plan for next month. I will officially state that in the June meeting, I'll talk about GLP-1 agonists, as I've mentioned. That will be part of our June meeting. Next, Dave, for our communicable disease update.
So April is a transition month for communicable diseases, and fortunately, things have, maybe for the first time since onset of the COVID pandemic, started to behave as in a normal seasonalized pattern. Influenza is down across the country, across the state and locally. COVID down. RSV is now episodic, sporadic. So the inhaled respiratory contagions are all starting to recede. They still exist. Flu can occur as an episodic disease any time of year. COVID has not ever been a truly seasonal disorder, with peaks having occurred in virtually every month of the year. So those individuals who have specific risk should continue to take the precautions to protect themselves, including timely inoculations. But we are coming up to the arthropod vector disease times of year, that is, say, tick, mosquito, and other communicable diseases of that nature. And although they're not on the uptick yet, people should be aware the most important thing with regard to mosquito-borne diseases, in my perspective, also in the perspective of Disney, who has done a great job in a mosquito swamp of limiting the amount of mosquito-borne diseases in their properties, is control of water, control of standing water. And as little water as fits in a spare tire is enough to breed a mosquito colony. So controlling standing water. There is also a non-toxic approach to controlling your water. And the mosquito pellets or mosquito granules, which have Bacillus thuringiensis, which is a non-toxic, naturally occurring bacteria, which in high quantities in the water causes the emerging spinners to die and limits the reproduction of mosquitoes. So you can manage that in that regard. But prevention of bites is the best way to avoid the arthropod vectors, including prevention of mosquito bites, long sleeves. These days there are two organic-based repellents, picaridin and permethrin, both of which are effective repellents, and checking yourself and awareness. And for ticks, long sleeves, long pants, shoes with socks, inspecting yourself, and using appropriate repellents. So that's coming up. With regard to epidemic diseases, the mumps epidemic continues to rage in the Southwest. There are more outbreaks in this country this year than there were all of last year. We are following behind UK, which has seen exponential growth of their measles cases. They're about 2 years ahead of us. It has been epidemic growth. So this year, we're already over 1,000. Last year, the total was 250. The year before that, less than 100. In the UK this year, they're approaching 100,000 cases, and that is what happens when the most highly transmissible viral disease is no longer controlled by effective inoculation with greater than 95% penetration. And we are starting to see that may be the canary in the cage, because rubella and mumps are also starting to occur in episodic cases at rates not previously seen, with complications that haven't been seen in decades. It pains me too much to go on. I don't think there's anything else completely relevant to the Radnor community right now, but there is an abdication of public health right now. There was one other thing for summertime diseases. You can no longer count on federal level surveillance of foodborne illnesses this summer. It will not be there, and as a consequence, you need to be highly aware of the coleslaw, chicken salad, all the mayonnaise-containing foods that you might eat at a picnic. You need to be highly aware that you will not have the kinds of events, warnings of foodborne illnesses that you are used to in the past. The infrastructure no longer exists. Thanks for your time.
I did see an article the other day that I just kind of wanted to bring up, which is that cases of pertussis are also skyrocketing. There was a low in 2021. Last year there were 10 deaths from pertussis, which is whooping cough. And the previous years had been about 2 to 4. And they're already estimating this year that deaths are on track to exceed the total from last year. So in general, whooping cough is does not cause mortality, but certainly in some children that are susceptible and the unlucky ones, it can. And this is also related to decreased vaccinations for DTaP, in addition to the decrease in MMR vaccinations.
Thank
Any
Thanks.
other comments? I know a month or two ago, you said that you had noticed a lot of pertussis. I'm not sure if the county,
We see pertussis every year
Uh-huh.
in the high schools and the colleges. It's been that way for as long as I can remember. I think people don't realize that sometimes we don't, unless we have somebody who's got a long-standing cough, and this year is very confusing because we had so much pneumonia. We had to really tease out we did have cases of pertussis for sure, yeah. And they're treated differently now. We treat them earlier now than we used to.
excellent. Okay, so next on our agenda is a presentation. We are lucky enough to have representatives from the Delaware County Health Department here with us. Presenting for us today is Samantha Cooper, MPH, and we also have Marie Carbonaro here, who is very familiar to the Board of Health from her years of service at Radnor.
Share the screen for the Zoom member. One second.
Hello and good evening. My name is Samantha Cooper. I'm with the Delaware County Health Department and Division of Environmental Health Services. I just wanted to provide a brief update. I was here about 1.5 years ago to speak on the transition from the local health department to the county health department. In that time, we have significantly improved our workflow and have become much more efficient in our services. And we've also had a little bit of restructuring as well. So just starting with the vision, mission, and values of the Delaware County Health Department, we always love to start with this. Our vision is to see all members of the Delaware County community have access to the resources that provide the opportunity to lead a healthy and productive life. Our values include equity, collaboration, leadership, accountability, innovation, and stewardship. We love to incorporate those multiple times throughout the year with all of our staff as we do our trainings and as we do our work in the field. We also have here our mission. Just a little bit of a breakdown of our division. We have 1 administrator, Marie Carbonara. We have 3 supervisors, myself, John Sharp, and Zachary Babel. We have 1 sewage enforcement officer, 11 environmental health specialists. Those are what we commonly refer to as the inspectors that you see out in the field. And we have 3 administrative professionals that assist us in the office. Like I said, we did have a few changes since last time I came to speak to the board. The biggest change is we have now divided the county into 3 zones. These zones each have 3 to 5 environmental health specialists assigned to them. This allows us to be much more efficient and allows us to have people in all areas of the county every day. As you can see, Radnor is part of Region 2, in which I'm the supervisor. It goes right down the middle of the county. On the eastern side, we have our Haverford, Upper Darby, and on the west is more of our Chadsford, Concord, Bethel. Again, allows us to be much more efficient and stay within a geographical area throughout the day. Our current environmental health programs include food safety, public bathing places, organized camps, campgrounds, and mobile home parks, institutions including schools, daycares, hospitals, and long-term care facilities, our mosquito-borne disease control program, as well as our on-lot septic and well water. Our key services for 2025 include basically licensing and inspecting all of our retail food facilities, our public bathing places, our pools, institutions, campgrounds, mobile home parks, private on-lot sewer inspections and permitting. The mosquito-borne disease program, there's no licensing or inspecting that happens there, but it is a very intensive program that's kicking off this week. Public health nuisance investigations, so we do service all public complaints within 24 hours. We also provide educational resources and presentations at various events and schools throughout the year. So going into the specifics regarding Radnor Township, I pulled this data for 2024. you had a total of 255 facilities that were inspected by the Delaware County Health Department, which included 375 different inspections. Throughout all of our jurisdictions, there's over 2,400 facilities, and last year we conducted over 5,500 inspections of all those facilities. All right, so breaking it down, going service by service. Public bathing places, we conduct the inspections at the beginning of the season. So in order for a pool at your apartment complex or school to open for the year, they are required to have an initial inspection to ensure that all of their water labs are clean and clear. They have all of their safety and rescue equipment and all current certifications on file. We document and investigate all complaints reported to the Delaware County Health Department. We also monitor abnormal labs. So all of the pools are required to submit water testing on a weekly basis. If that water testing shows coliform bacteria, which could be harmful to especially our very young and our very old, we monitor that. If it exceeds certain levels or continues more than a week, they do have to close the pool to be able to prove that they have clean water for the public to swim in. And we provide an educational approach towards compliance. So we're kicking off right now before we get to Memorial Day, getting all of that information out, making sure everyone's fully aware of what their responsibilities are when it comes to these facilities. So Radnor had 21 public bathing places. All routine inspections were completed in 2024. So our routine inspections include both the initial opening inspection as well as one compliance inspection at least throughout the season. And 100% of the facilities were registered and in compliance with that. Moving on to institutions, we conduct inspections and issue certifications in accordance with the Delaware County Health Code. We respond to all complaints for those institutions. We document and investigate all communicable disease outbreaks at these facilities as well. Going into the specifics of Radnor Township, you have 30 institutions. We conducted 100% of the routine inspections. Oftentimes, these are twice-a-year inspections. And 93% of the institutions in Radnor Township are in compliance with the certification per the Delaware County Health Code. All right, our biggest program is obviously our food safety program. That's the one that everyone hears about the most. We conduct all food safety inspections. We license all retail food facilities. We document, respond to, and investigate all food safety complaints, potential foodborne illnesses, and outbreaks reported to the Delaware County Health Department. So everyone loves to hear about the outbreaks, but how do you know it's an outbreak? You know, typically it starts with 1 or 2 people giving us a call. I felt a little funky after eating at a couple different places, and we have to use that data to pinpoint potentially the source and the cause. We provide public access to all food safety inspection reports. You can look up any report at any time within minutes of the inspector leaving. Again, we provide an educational approach to compliance with the PA Food Code and the FDA Food Code and the Delaware County Health Code. Our goal isn't to go into these facilities and shut them down. It's to ensure that safe, wholesome food is being served to the public. So we do a lot of hands-on educational approach to the inspections. So it take a little bit longer than some traditional inspection styles, but that way when we leave, we've left them with something. We conduct at least 1 annual inspection at all retail food establishments. We conduct 2 inspections at all of the institutions for the food services. And then we review plans for construction, remodeling, or alteration of retail food facilities within regulated timeframes. So anytime you make a renovation, we have a change of ownership, or we're adding in some new equipment, we review that in advance to ensure compliance with code. In terms of food facilities, there are 204 food facilities in Radnor Township in 2024. I'm sure you've seen as you've driven through the neighborhood, that's going up in 2020-25. We have conducted 100% of the routine inspections, and every single food facility in Radnor Township is in compliance with licensing. All right, moving on to septic and wells. This information is for the entire county. We had 55 sewage permits issued, 62 well permits issued, and 56 well contractor, geothermal installer, or pump installer licenses issued. Our new program in 2024 was the liquid waste hauler inspection. So anytime there is liquid waste moving throughout the county, that vehicle needs to be inspected on an annual basis. We had 249 permits issued in 2024, and that's for a 6-month time frame. That program only launched July 1st of 2024. So our sewage enforcement officer put in a lot of work to make sure that was done in a very timely fashion. All right, kind of bouncing off of the last conversation we had, mosquito-borne disease control. In 2024, here, these two graphs show the difference between 23 and 24. The average number of mosquitoes collected, you could see in 2024 compared to 23, on average, we collected less mosquitoes. What's the difference? Why did we collect fewer mosquitoes? Were there fewer mosquitoes out there? We would like to believe so. We did a lot of work in preventative controls in 2024 to ensure that those populations did not go out of control. And that's reflected in the average vector index. The vector index is an aggregated score as the potential for West Nile virus to be in an area. And you can see as we continued throughout the weeks in 2024, we almost eliminated that vector index. All right, so I just wanted to share some fun things and other things that we have going on in environmental health. We're celebrating 3 years this month of the Delaware County Health Department. You know, some companies get a fun pizza party on your anniversary. We gave back to the community by cleaning 3 parks. So we have our annual Clean the Green, where we went to 3 parks, beautified, planted some flowers. This was a couple Fridays ago where it was cold and rainy, so really applaud our team for getting out there and making that happen for the community. The beginning of this month was also National Public Health Week. We did have a social media campaign for that week, which included some sites around Wayne. So I'd love to share that short clip with you.
It's National Public Health Week, and at the Delaware County Health Department, it starts here.
It starts with a safe environment.
Our Environmental Health Division ensures wastewater safety, safe food, and protection from vector-borne illnesses.
It starts with access to services and vital information.
My name is Samani. How can I help you today? The Population Health Division connects communities to vital resources, tracks data, and prepares for emergency services.
It starts with prevention. Our clinical services administers vaccines, provides testing, and care for our residents.
Hi, good morning. How can I help you today?
Happy National Public Health Week to all our public health colleagues across the country. Together, we are building healthier and thriving communities.
All right, and the last thing I wanted to share with you guys is our 24-hour wellness line. If you have any questions, concerns, complaints, if you're feeling ill after eating at a restaurant, this is the number to call. Again, it's staffed 24/7, 365. From there, it's disseminated out to the individual divisions that would address those calls. I believe we also have a nice flyer of this right in the hallway for you as well. Again, anytime you need to reach out to the health department, you have questions about our services, this is the number 1 number to call. Okay. Thank you so much for your time. If you have any questions, I'd be happy to take those now. Yeah.
How do you do the vector, the mosquito-borne? I'm not sure about that program. What does that look like?
Yeah, so
I see you guys putting out boxes and stuff. I don't know how that works.
Yeah, so the program is funded by the state itself, and we follow their protocol. So we have 2 different types of traps that go out. One is the boxes that you see. The other one is like a BG trap, which is meant to kind of simulate a person. It has like a scented odor stick in it. We collect the mosquitoes, count them, we send them to the state labs, and they test them for various diseases. So, yeah.
Yeah, I have a quick question. Oh, sorry, over here. You were talking about septic permits. Is anyone with a septic tank in the township required to have a county permit?
So they're required to have a permit anytime you're making repairs, replacements, or any changes to the
Phew.
system. So
I was a little worried. I have a septic
Oh, no.
system. I'm like, I don't think I
hope you
have a
never need
permit.
one.
Okay, so if any repairs, if it were changed out, how about just being pumped?
I believe if it's being pumped, I would defer that back to our.
I mean, that happens once a year or
I
so.
think the pumper themselves report it back to us. No? No.
Okay, thank you.
Sorry
That's
about
really
that.
helpful. I didn't know about that.
Yeah, I don't really get into that one as much, but again, very, very busy part of our division.
Thanks so much.
Of course, thank you.
Thanks for the update. We really appreciate it. And having been with this Board of Health since before the existence of the Delaware County Health Department, we are thrilled to have a county health department. And personally, I'm thrilled with the progress that you've made. We used to see in this Board of Health the food safety reports, and they were interesting, and one of the board members was very familiar, Alex, who's no longer a member of the board. This is a long question. These days, there are online publications that send out the reports, Radnor Patch, Mainline Today, whatever. And I find that the reports that are published are just not informative or helpful because it's just a count. And in fact, I think it might almost be counterproductive because people want to know that the restaurants that they're going to are safe and what's been going on. And I wonder if it would not be possible, asking you to do more work, to figure out a way to format the reports so that the lay individual who sees them in lay publications can have a better sense of what's going on with those. And just an idea.
Yeah, so unfortunately, we can't control what's published by third parties. I would always refer you back to our website. Our website has the full report posted, including all of the inspectors' comments. What other publications choose to do with those, we can't quite control. Some only, publish certain types of facilities. Some only have, the number of violations. Some aggregate their own score based on, again, those counts. So unfortunately, we can't control that, but on our website, the full inspection report is always available.
I think a lot of those resources as well do frequently have a link to your website. So I would encourage people to do that because you're right. It just says I don't want to bring up a restaurant, George's. I don't think we have anything called George's here. Hopefully not. George's 3, but it doesn't really tell you what those violations were, right? And so if it was, mice in the rice, that's going to mean something different than you didn't have enough hand washing stations in the restaurant, right? I have a question about the map slide that you had posted. So there were several townships that were white. So is that because, why is that?
So right now, those are locations where we do not have jurisdiction due to ongoing litigation.
Okay, got it. So everything that's covered, the township has agreed to the county basically running?
Yes.
Okay, got it.
What would happen to your resource availability should all of a sudden the townships who are not in line come online? What would happen? Would we get less attention?
Absolutely not. We've actually planned for that. We do have plenty of environmental health specialists available to be able to take on that workload should anything change with that.
Really appreciate everything that the Board of Health is doing in the county, especially as it seems that we'll be getting less assistance from federal. It's great to know that, kind of local and state governments are really showing up to assist. I would encourage people, the website is excellent, bringing up recent events, which Samantha is not an expert in, so don't ask Samantha any questions. They just announced today that likely they announced it is closing Chester, Crozier, and Taylor. Doesn't affect us too much up in this area because those hospitals are down more in the county, but that leaves the county with 2 hospitals at this point. And I know that I think Ridley Township, the mayor, issued a public safety announcement. Crozier helps maintain some of the ambulance services, et cetera. So there are excellent updates regarding that and places to go to get care on the Delaware County Health website. So just for everybody's attention. Excellent. Any other questions?
Did you see that today, Lisa? I thought they had 30 days from today, but maybe I read that wrong.
Well, they announced that it is definitely closing. They were unable to get a deal.
Okay.
And there were layoffs sent to employees. But I don't know when exactly when they're closing per se. I mean, they said ERs will start on Wednesday, but does that just mean to ambulances, still walk-in? Who the heck knows? I would like to know because my husband works there, but.
Oh, wow, so you do know. I know, we had a guest last night who works in L&D at Riddle and said that they are just overwhelmed by births because Crozier did a lot of births there. And Riddle does not do as many, and so they're really overwhelmed.
Yeah. And I know some people will come up to care in Bryn Mawr, so I do think it is going to affect our services and availability in this area. But mostly it's just terrible for the people who live close to those facilities.
Thank you.
Thank you, Samantha, so much. All right, so I didn't have anything listed for old business. New business, our school liaison is not here today because they were off of school today. But Maggie's here from the Board of Commissioners. Anything new for us?
Not a whole lot new. We're doing a lot of land development, as I say. I preface every single time. But we do have a couple. I want everybody on their way out to look at the new EV chargers that have been going in over the last couple of weeks. We've been talking about how the township is trying to convert police vehicles and township vehicles over to be electronic vehicles. So just had these chargers put in. And they will be expanded as the vehicle fleet expands. And the only other thing of note is I just wanted to say we did re-up. We have a veterinary practice that takes care of abandoned or pets that need to be taken away from their homes or households. And we did re-up that. So we have a nice, safe place for pets that are picked up on the street or by the police or wherever to go until their owners can safely take them home.
So that brings us to public participation. Anyone from the public have any comments for the Board of Health?
Good evening. Good evening. My name is Jillian Norris Santo. My address, 424 Inverary Road in Villanova. And my comment concerns the avian flu variants. I believe we need the latest information on avian flu variants and infections, and we look to the Board of Health as a reliable source for that information and for advice on prevention and treatment, all relayed to the public as rapidly as possible. And as you know, a rare strain of avian flu, H5N9, was detected in February. There'd been a death in Louisiana caused by an earlier strain of the disease, H5N1. This is not considered a serious threat to humans. However, the virus spread rapidly among birds, especially flocks of poultry and dairy herds, and now I read just this week in Britain, 1 sheep so far has the virus. The avian flu could become more dangerous to humans through something called reassortment, which is defined as a process involving the mixing of different flu strains, within an infected host. The more virus and the more hosts that exist, the more likely it is that we will be infected by a new form of the virus. Angela Rasmussen, a virologist at the University of Saskatchewan, told the Washington Post, "It does suggest that there's enough virus around that reassortment might become more frequent. With enough H5 in these animals and enough seasonal flu in humans, you get them together and you have a recipe for a potential pandemic virus. I'm concerned about all of us, and especially about seniors, of whom I am one. Many of us live in continuing care retirement settings and nursing homes, which are subject to the spread of contagious diseases. In addition, immunity declines with age, even if you get all the vaccines, making the old even more vulnerable to infection. We and the local healthcare community, meaning all of you and all of our healthcare workers, must have the most up-to-date information on the incidence of the virus, its symptoms, and how to treat it effectively. And this information, of course, must come from the Commonwealth and the County Health Department. Being prepared could be a matter of life and death, because these are our first line of defense. Thank you. And I'd like to give you the article I was looking at.
Thank you so much. Any other public comment for the Board of Health?
As past president, I'm Roberta Winters, 326 Williams Road in Rosemont, and as past president of the League of Women Voters of Radnor Township, I want to commend you for your continued support of the Delaware County Health Department, and it's a pleasure not to have to come here year after year and beg you to continue it. Thank you.
Thank you. Right, anybody, any other public participation or anything else the board has? All right. Our next meeting is May 20th, which is a Tuesday at 5:30. And I will adjourn the meeting. Well, I will, anyone vote
Move to adjourn.
Move to adjourn. Move to adjourn. Dave moves to adjourn. Any seconds?
Second.
No second. And we will clear the room so everybody outside can get in.